So, hi everybody. I'm Karen, and this is Tinks, and we with the PetsPage Show here with Karen and Tinks, and I am honored to be joined this evening with my guest, Dr. Sue Ettinger, who is a board-certified veterinary oncologist, and she practices out of Animal Specialty Center in New York, and she's also the author of the Dog Cancer Survival Guide. And then she has a kind of the cancer vet segment on the Radio Pet Lady. And so she's got a bunch of stuff going on, and she's actually also one of the veterinary specialists that you can find on PetsPage.com. And I'm very kind of honored that because she is such a great advocate for our pets' health, she is, I've been doing some amazing things to enhance the lives of our pets. I have invited her to join Tinks now in our educational documentary where we're going to increase awareness of vet specialists and also encourage vet specialists general practitioners to work together with vet specialists as a team when needed to ensure the best outcome for your pet's health. And so well, with all of that, woo, very, very, very excited to have this guest here with us. So Dr. Sue, and she's actually known on the internet world a little bit more commonly as Dr. Sue Cancer Vet.
Yep.
We were kind of talking about a variety of different things, and I really wanted to kind of, if you could kind of briefly kind of let us know a little bit about your training that you had. As I said, she was a board-certified veterinary oncologist, which is a little more advanced than a general practice veterinarian. So she can tell us about that, and kind of then what also is your typical day, like what are your caseloads? What type of patients are you treating?
So after vet school, after 4 years of vet school, I did an internship in general medicine and surgery, and that is not required when you graduate from vet school. You can go into practice. And then after that was when I got interested in oncology, so then I decided to do a 2-year residency exclusively in medical oncology, that we have a little bit of training in radiation oncology. Wow. And then you sit for a special certification exam to become a board-certified specialist in whatever field that you're studying. Right now, I'm in a very large, busy practice in just north of New York City, the Animal Specialty Center. I see on average 10 to 15 dogs and cats a day.
Wow.
Usually about 2 new cases, so cases that are coming to see me the first time. And then the rest of mine are chemotherapy patients that are coming in either for treatment or just follow-up during their treatment, or just follow-up after they finish their treatment.
Wow, that's a lot of patients. I did not realize that you were kind of seeing that many. So,
yeah.
Well, that is it's just the cancer patients that you see.
Yeah,
You're not kind of seeing
I only
else.
see patients that have been diagnosed with cancer or have a very highly suspicious aspirate or biopsy that's very suggestive of cancer, or maybe an x-ray of a bone that looks like cancer. But most of the time, the cancer has been diagnosed by the general veterinarian, and then they send them over to me for the next step.
Okay, well that sounds great. We'll get into a little bit more of that. So I was kind of wondering, I know sometimes whenever your pet is diagnosed with cancer, I know I don't even want to talk about that too much. Luckily, I've not experienced that, but I can imagine it must be kind of like, the C word. People are kind of freaked out and not sure what to do. And so most of the time, I from what I probably understand, is that the diagnosis is coming from the general veterinarian that has been kind of seeing the pet on a regular basis, and so they kind of have a choice, or when do they so what do they say, like maybe if they come to you to see you, a board certified oncologist, kind of like later in the game, maybe they didn't come to see you right after they got diagnosed?
There's the two situations. So a lot of times the primary veterinarian will make the diagnosis and then send it over to see me. And I always tell the general vets they have the hardest job because they have to break the bad news to the owner. And there are many vets in my area who will call me and say, I'm sending Jack over to see you. He was diagnosed with lymphoma. They're not going to treat, but I just want them to see you to hear what the options are. And then if they decide not to treat, what can they do to keep the pet comfortable? So Jack will come over. He'll have lymphoma. We'll talk about how well they can tolerate treatment, how side effects are very minimal, and I'll call the vet at the end of the appointment and say, we just started treatment with Jack, and they'll be shocked, but there's a lot of thinking and thought process from the time they hear the original diagnosis where they're in shock, and then they learn more about how well dogs and cats that have cancer, how well treatment, and that the goal of treatment is not just to live longer, but live well. And that's my mantra. We never want treatment to be worse than the disease itself. Okay. So it's really important. So a lot of people who will tell, their vet, I'm not going to treat, definitely consider it. And I think that's why it's so important to get to the specialist. It's not a contract. You do not have to treat if you come see a specialist.
Just to get it up.
But go there and find out more about the disease, find out more about the treatment, find out, how long are they going to live without treatment on average? How long will treatment live? Or how long will they live, with treatment? And then you can start to break it down and decide what's right for that family.
So do you feel like in that case it's your duty to kind of educate them of kind of what all
right.
they're about to face?
Right, and and it's not just black or white. It's not like, and lymphoma is a good example because without treatment, the average dog lives a month. It's really quick.
Wow.
It's very rapidly progressive. With your average chemotherapy protocol, about 12 to 14 months, the median. So half the dogs live longer and half the dogs live shorter. And people say, well, a year, that's not long. To us, it's not. Yeah. We love our pets so much, but in the lifespan of the dog, a year is a really significant amount of time when you think about how long they live, right?
Yeah.
In people, they talk about 5-year survival times, and we live 70, 80, 90 years.
Yeah.
So, 30 days versus a year plus is a significant extension of their life. And so I think that's what you have to start thinking about when you're thinking about whether or not to treat is how much time will I get with treatment, how much time do I get on average without treatment, and then what does treatment entail? But then realize it's not just treat or not treat. There's often different treatment protocols. And you can say, well, this one's the best, but you're going to have to come in this often and it costs this much. But this one, it's maybe not, the best, but it's still a really good protocol. And they have really high response rates. You may only get 6 to 9 months, but they're going to feel so much better. So that's really what we're trained in, the full spectrum of approach where, it's not just treat or don't treat and I have nothing for you.
Yeah. Well, yeah, it sounds like I didn't realize there were so many different kind of options.
It depends on the cancer and the patient, but in general, there's a lot of options, and people, need to learn about that.
So if somebody does kind of, they decided, maybe their veterinarian kind of did say, yeah, I want for you to go see an oncologist, and maybe they didn't go to see an oncologist such as yourself, or maybe the veterinarian, for whatever reason, kind of did not encourage them to go to see an oncologist whenever they had the diagnosis. So whenever, then maybe later they end up on your doorstep, so just later. So what are the kind of reasons? Why are they not coming earlier?
Sometimes it's the owner wasn't ready to treat. They just, they just thought they're going to get really sick. I would never put my dog through chemo. A lot of times, our individual experiences shape us. So maybe they had a family member that had cancer and they watched them go through really bad treatment. And so a lot of times they're afraid of the treatment, so they don't come. Sometimes they weren't offered the referral. They don't know that we exist. Yeah. And so, it's really important to spread the word that, there are oncologists. For me, the right time to come see an oncologist is as soon as you get the diagnosis. It doesn't have to be tomorrow morning, unless it's lymphoma. Then you should get in the next day or the next few days. Lymphoma is one where I will squeeze you in the next day. We will, we really want to, because it makes a difference. There are other cancers you can come in a week or 2 or even 3 weeks, and it's going to be fine. But once you have the diagnosis of cancer, you should go and see an oncologist. Sometimes a general vet will say to me, well, do I need to do the chest x-rays and the ultrasound so we know if the cancer is spread? It's not wrong to do those tests, but sometimes we do those tests and they come and see me and they don't want to treat anyway. And so then the owner's out hundreds of dollars on tests they didn't need, but their vet thought that I needed it, but we didn't need it. So it's not wrong to do those tests before you come in, but if you're thinking you don't want to treat, it's okay to wait until you come and see the specialist and then find out, do you need chest x-rays, blood work, ultrasound, and things like that. So for me, get a diagnosis and see the oncologist. And
then go. That sounds like some great advice because you have a lot of information to share.
I do. I have very long appointments, which is good. Yeah. They're not rushed. We schedule an hour for each new appointment. That's between the nurse coming in and me. And so it's really important, again, to go through all the different options.
Because I know they're probably like information overload sometimes and they just need kind of time to process.
And that's actually the really good thing about the book and the blog that, a lot of people will go home and what I say about chemotherapy or their pet's cancer, mast cell tumors, they can go home and read the chapter, and now there's the dog cancer blog. And again, I blog on different cancers and common misconceptions about chemotherapy treatment. So people aren't going to hear everything,
No.
their mind is circling and worried and stuff like that. So we give them a lot of information, and then we give them resources so they can go home, curl up under a blanket with a hot cup of tea, and maybe reread the information again. Exactly.
So, and that's the Dog Cancer Survival Guide with all of that different information in there. So that is awesome. So just kind of to bring it back again, on whenever they maybe don't come to treat with you like early on, but they opted to stay kind of and treat at the general veterinarian and did not come to see you, kind of for whatever reason. Have you noticed any sort of correlation between the success rate and kind of the overall kind of how they feel whenever they come to you earlier?
Unfortunately, yes, especially if they weren't treating, because the cancer can get more advanced.
Oh, yeah.
So the patient can lose more weight, they're not feeling well, they're starting to lose their energy and things like that. So in general, the earliest you get early diagnosis, early treatment before the cancer is more advanced usually is going to lead to better outcome. And I mean longer survival times. The pet will live longer. So again, you really want to see a specialist and make a decision. It's okay not to treat, but at least make that decision early. The frustrating cases for me are the ones where they come 2 months later and they said, oh, why didn't I come earlier? And I'm thinking, why didn't you come earlier? And then, you can still start treatment, but I feel like we're 3 steps behind. Yeah. And so it's frustrating for everybody. But hindsight's 2020. You just got to move forward, be positive, and do what we can do now.
Make the next right step.
Exactly.
Yeah, no, that I know. I can imagine if you didn't come early for it. Maybe if your vet didn't let you know that was kind of even an option, and then you were kind of struggling, and then to find out. Kind of as my case with Tinks, whenever he got really sick with his autoimmune disease and almost died, I am fortunate that I found out just in enough time to save Tinks' life.
Just in enough time.
Just enough. I was exactly. I was just kind of floored finding out everything that I found out, that I did not get a referral sooner to a veterinary internist to help me with such a very serious autoimmune disease with my sweetie. So that is kind of why I'm an advocate for pet owners kind of knowing that veterinary specialists exist and encouraging general vets to work together with a specialist whenever needed. In some cases and diagnosis and things like that, it's important. I mean, y'all are specialists, highly specialized, only see these type of cases. So to bring it back to oncology and the dreaded C word. So what are some reasons, like if a general practice veterinarian, the pet owner was treating with the general veterinarian, and then later maybe they have arrived, if they kind of come in through the emergency room or something like that, they now have been transferred into your care to give the chemo and to treat them, your treatment plan. What are some of the reasons?
Yeah, so sometimes a recent case that I saw, Drew was a dog that was treating with the primary veterinarian for his lymphoma with weekly chemotherapy and was getting really sick and ended up at our emergency clinic. And saw that there was an oncologist there, and so came to see me the following week. And he had been through 4 weeks of chemotherapy, had gotten sick every time, got hospitalized one time, lost a lot of weight, but they were under the misconception that dogs on chemo get sick, and that's just the way that it is. And the truth is, 80% of dogs on chemo have no side effects. That's really high. That's great. And about 15 to 20% of dogs will have very mild side effects. And then less than 5% will require hospitalization due to severe dehydration, maybe due to vomiting. But that's uncommon. And if they are having mild side effects or severe side effects, we can adjust the chemotherapy, we can use preventative medications, and we can really adjust the dose. And I rarely have a patient get sick more than once, especially severely sick. And the cool thing about Drew is I adjusted his chemotherapy. We were very proactive with his nausea medications. He needed more nausea meds than most dogs, but that's okay. We learned that, he did not like vincristine. It made him sick. We lowered the dose. He goes preventative med. The dog has gained 12 pounds.
Wonderful.
And he's scheduled for his last treatment next week, and he is just, the owners can't believe that he has cancer. Because he's healthy, he's vibrant, he's going to the park, and and that's the other thing. People think, oh, I have to go through all this horrible chemo and then will my dog feel well? No, they should be feeling well. Maybe, they might be a little bit tired one day or maybe a little bit off. But during treatment, they feel well. They're running. They're going to the park. They're, sitting on the couch watching TV with you. Whatever it is they love to do, they're doing it during treatment and after treatment, and that's why we treat.
Yeah, and so that's kind of what the goal of your live longer, live well is.
Right.
You want for them to be comfortable as well.
So that would be one reason that, is that they just didn't know that there was sometimes it's convenience. They think, oh, well, I can go to my vet, it's closer, I don't want to have to travel a half hour. Most of the time after a client comes and sees me, they see the value, the expertise. All I do is treat cancer. I don't treat kidney disease. I'm trained in that so I can identify it and manage it a little, but cancer is all I focus on. Articles, conferences, cancer. If you had cancer, if I had cancer, we would go and see an oncologist. And if your dog or your cat has cancer, in my opinion, you go and see an oncologist. And
thankfully, there are veterinary oncologists today. About how many are there?
Just about 300 in the United States.
300.
It's a lot less than some of the other specialties. And so that is the hard part. In certain parts of the country, there aren't oncologists. Typically, if you're in a part of the country where there is not an oncologist, the internist, the internal medicine specialist, will do some of the chemo because they have a little bit of training of that.
Under the same kind of
the same umbrella.
College,
and so you can go to acvim.org and you can click on find a specialist, put in the specialty, whether it's cardiology, heart or internal medicine, oncology, and they can help find a specialist near you based on zip code.
That sounds awesome. So I guess when knowing everything that we have just found out about kind of all the different options and things like that, and how specialized kind of your training is, so why in some cases, sometimes the general veterinarian does not even let the pet owner know that, hey, there are oncologists. Why do you think that is?
I don't know. I mean, there's lots of reasons. I think sometimes they think the owner doesn't want to treat. Some vets, unfortunately, don't realize that cancer is treatable. People think cancer is a death sentence, and cancer is a huge term for many diseases. And there are some cancers that I'm not as enthusiastic about how well the, treatment extends their treatment, and we might not try to do surgery or radiation or chemo. We might go into comfort mode, pain medications, palliative, therapies to keep the pet comfortable. So I think sometimes, or they had one dog that did really poorly, and so that's their experience that shapes it. So I think, unfortunately, there are some vets who don't think cancer should be treated, and so they don't offer that option. And so that's really, for me, one of the exciting things about the book and the blog is reaching people directly and having them get this information and then seek out. And it's really wonderful to get posts and emails from people say, I read your book and I found a specialist, my dog is going through treatment and they're doing really well. And that just, it's one of the reasons I do all that I do, because that's what we're trying to do.
Yeah, no, that sounds awesome. I know that that if I, anything happened to me or anybody around me, I would definitely, be thankful that there is an oncologist. And actually, here in Boise, we're lucky to have we have an oncologist here now. So they are in high demand. I definitely I definitely know that. So that is good. I guess that's kind of, unless you had anything else that you wanted to share. I know that I think it's wonderful information, because it definitely goes right along with kind of with my mission to increase awareness about to other pet owners about veterinary specialists, and because it is something that is very important to me. And so actually, if I would love to invite you to share your story with us, if an oncologist has made the difference in the life of your pet, or kind of made those the year or 2 or 5 years more comfortable, and you've got a story that you'd like to tell, or maybe something along those lines, we'd love for you to share that with us. Throughout the month of November, we're going to be focusing on the pets, the amazing pets that we're thankful for, and also the amazing veterinary specialists who have saved them, or have helped them live longer and live well. So I definitely invite you to share your stories with us on PetsPage.com. Look for the share icon, and you can kind of put your information in there, and we'll actually be doing interviews we'll be selecting people from there to do interviews with, so you could share your story with us here on the PetsPage Show. And I guess that's kind of, for more information, if you could visit more information, or to find a specialist in your area, if you visit PetsPage.com, our social pet community that we have there. And if you could please like and share this video with your friends. All right, that's it for next time. That's it until next time. See ya.